what happened today, a young female patient come into emergency with one side of the face is not moving. Looks like the patient is having stroke. But think twice, it might be Bell's palsy. So hello everyone, in this video we'll talk about Bell's palsy. Let's find out. So what is Bell's palsy? Bell's palsy is the sudden weakness or the paralysis of one side of the face. But why it is happened? It is because of the compression or inflammation of the seventh cranial nerve, that is the fascia. So what are the causes of the Bell's palsy? First is the viral cause. Viral cause, examples like herpes simplex virus, maybe Epstein-Barr virus, varicella virus. So these are the causes. Now next cause is the cold, because of the extreme cold exposure. Next one is the diabetes mellitus. Next is the hypertension or the pregnancy, especially in third trimester. Right? So what signs you will see in the patients of Bell's palsy? First is the absence of the forehead wrinkles. If you tell the patient to raise the eyebrow, patient not able to raise the eyebrow. Second one is smile. Patient is not able to smile or blink the eye on affected side. Right? Now the third one is the absence of these nasolabial folds. Every human being has this naval fold, but in those patients with Bell's palsy, there are absence of the nasolabial folds. Now, and next one is the facial drooping. Patient is having facial drooping on one side. So remember all these things. For this, you need to learn one mnemonic that is called FACE. So here F represents the facial drop. A represents the absence of the forehead wrinkles. Here next one is the C. C represents cannot close eyes. That's also called the Bell's phenomena. Next is the E. E represents I need protection. आई को जरूरत पड़ेगी आर्टिफिशियल टीयर, आई ड्रॉप्स की. What will be the treatment for this? For the treatment, see the cause. So if there is a viral cause, then we'll give the antivirals. Antivirals like acyclovir. Now for eye protection, we'll provide artificial tear or some eye drops. And next is if there's inflammatory cause, then we'll give the prednisolone. Also, one more thing, the physiotherapy, the facial exercise. We tell the patient to do facial massage, facial exercise, so that it can be relieved timely. Most of the time we get confused between Bell's palsy and stroke. So Bell's palsy, the peripheral cause. Peripheral means nerves cause, means the cranial nerve 7th involved. But in stroke, there is the brain supply, brain blood supply is shut off, means the brain functions are deteriorated, right? Next one is the Bell's palsy. The major difference between the two is there's an absence of the forehead wrinkles in the Bell's palsy.